We were looking at the reasons for in vitro fertilization. One of the reasons for in vitro fertilization was tubal blockage. So today we will be discussing tubal infertility. Let us know that the egg is fertilized in the fallopian tubes. From the tubes, the fertilized eggs move into the uterine cavity. Now, if there is tubal obstruction, there is series of impediments to this movement. Tubal obstruction is reported to be 12% to 33% of infertile couple. And there are various ways which we can make a diagnosis of tubal blockage. Number one is what we call the hysterosalpingography, which we refer to as HSG, which most of my patients tell me that is usually very painful. This is a radiographic evaluation of the uterine cavity and the fallopian tubes after injection of radiopaque medium through the cervical canal. Number two, hysterosalpingocontrast sonography, which we refer to as ICOSY. Number three, we can also do what we call a laparoscopy and dye test. Now, this will enable us to assess whether the tubes are blocked or they are open. The fallopian tube integrity is a function that can be affected by a lot of factors. There is tubal obstruction, there is tubal occlusion. Now, tubal occlusion can also either occur at the proximal part, the distal part, the unilateral part, or bilateral parts. There can be peri-adnexal adhesions, that is around the ovary, the fallopian tubes, there can be adhesions. Pelvic inflammatory disease have been found to affect the tube. Endometriosis or previous history of tubal surgery can cause any form of obstruction or occlusion. Sexually transmitted disease. For a patient that has had infection that has ascended up, they can occlude the tube. A woman who has delivered before and there is complication, for instance, if there is infection, which we call post-pregnancy sepsis. Intrauterine contraceptive device can also affect the tubes. What are these infections that affect the tube? The common infection affecting tube is chlamydia trachomatis. Other infections such as gonorrhea, which accounts for 30 to 50% of a patient that have bilateral tubal blockage. Let me conclude by saying the severity of tubal infertility is due to pelvic infections depend on the number and severity of episodes which the patient was exposed to. By way of summary, tubal factor is a cause of infertility. It can be diagnosed by HSG, sonohysterosalpingogram, laparoscopy and dye tests, and the commonest cause of tubal blockage is sexually transmitted disease. My name is Dr. Ede Edo Bolo Osazua, the only doctor of hope. Thank you.